Hi, my name is Norilyn and I'm a registered nurse. Today I want to talk to you about why it's very, very important for a person who has been diagnosed with high blood pressure, also known as hypertension, to control it or manage it properly. Everybody knows that having high blood pressure is not good for your health. Your doctor will always insist that you need to take your medication to lower your blood pressure, or he will insist that you need to change your lifestyle if your lifestyle is contributing to your high blood pressure. He will tell you to eat healthier, eat more vegetables, limit your salt intake or your sodium intake, and he will tell you to eat less fat or low cholesterol foods. He will also tell you to exercise regularly, lose weight if you are overweight, and he will tell you to limit your alcohol intake and stop smoking if you're a smoker. Sometimes it just takes this lifestyle changes, and after a while, after a couple of months, your high blood pressure will be cured. So sometimes it just takes those things. You do not even have to spend money on medications, and by just doing this healthy lifestyle, you can be cured. You can actually cure yourself. But some people, even if they do everything right, they still in need of medication to control your blood pressure, to control their blood pressure. I did have one patient that I cannot forget. This happened maybe 14 years ago. If you just look at him on in the outside appearance, he appears to be very, very healthy. This guy is around between 50 to 55 years old, clean cut. He's dressed very, very well, and he looks like he lives in a gym. He's very, very fit, very muscular. He looks like he takes care of himself. The thing is, he's been diagnosed with high blood pressure for years. And even though he's been taking care of himself, he's doing everything right, he still has high blood pressure. But the thing is, he does not have any symptoms. For some people, they do not get any symptoms. They're completely asymptomatic. No headaches, no dizziness, no chest pain, no shortness of breath, no fatigue, no nothing. They feel good. They feel normal. They feel healthy. But because his hypertension was not controlled, and it got to the point that it actually damaged his kidneys. So during his admission, he was actually for an emergency dialysis. He did get a dialysis during his admission when I was taking care of him, but I do not know what happened then after he was discharged. But he was, at that time, he was, of course, depressed. I think probably he was thinking, what happened? Where did I go wrong? I was taking care of myself. I was doing everything to keep myself healthy, which he looked like he was healthy. But the thing is, sometimes, even if you are doing everything right, you still need some medication to control your condition. And in this case, his high blood pressure. So, yes, the complication actually arise after years of not controlling high blood pressure. So the reason why you need to control your high blood pressure right now, do not wait for years to not control it, is because it can lead to severe complications like heart attack, stroke, or brain attack, or cerebrovascular accident is another name, or CVA. Aneurysm. Think about, like brain aneurysm or aortic aneurysm. Aneurysm can happen anywhere in your body. Heart failure kidney damage, think about kidney failure, like going on a dialysis and needing to have a kidney transplant. Think about vision loss. You can have vision loss that can lead to blindness, um, peripheral artery disease, trouble thinking or remembering, dementia, erectile dysfunction, and metabolic syndrome. So let's talk about why these things happen. If you do not control your high blood pressure, how come these things happen? Okay, the complication happens after years of not doing anything about your high blood pressure, especially for those people who do not have any symptoms at all. They feel okay, they feel good, they feel healthy. And actually, for me, it's even more scary. It's scarier because, you could have a stroke and you were not even prepared for that. You didn't even know that you have high blood pressure, so you can do something about it. For people who have symptoms like, headache or a nape pain or dizziness, they get scared. They actually go to the doctor and have themselves checked so that the doctor can do something about it. The doctor can give them medications to control their high blood pressure. But for some people, they do not have any symptoms. They're completely asymptomatic. Um, on that note, I just want to urge you to at least know your baseline. What is normal for you? So that you would be able to tell if you do have high blood pressure or not. Um, okay, let's go back to why do you need to control your high blood pressure right now? The complications happen actually after years of not treating it. Um, and the reason why is because if your blood vessels is in constant high pressure, it can lead to narrowing of the blood vessels. Now, when the blood vessel becomes narrow, it actually supply your vital organs and all the cells, the tissue in our body with less oxygen and nutrients. And if they supply the brain and the brain is getting less oxygen and nutrients and other things that it needs, it eventually dies. Because if your blood vessel gets narrower and narrower or smaller and smaller because of high blood pressure, because of it can, when you have high blood pressure, you are at risk for getting blood clots. Blood clots is basically your blood becoming solid, like very very small, but these blood clots travel everywhere in your body, and if it goes to your brain, you can have an ischemic stroke. And if your blood vessels in your brain gets weak, and then it forms a weakened spot, and this eventually bulges and it becomes big. Becomes like a balloon, and it's in constant high pressure and it bursts. You can have a hemorrhagic stroke or a bleeding stroke. So it's very very important for you to control your high blood pressure, because you do not know, one thing can lead to another and you can have a stroke because of high blood pressure. A lot of our stroke patients history was because they have high blood pressure, and that's the main reason why they got a stroke. Another thing is heart attack and heart failure, and it's the same thing. When the blood vessels in our body is normally very smooth, and they're usually elastic and flexible, they're strong. But once you have high blood pressure, they're in constant under this high pressure, the lining of your blood vessel becomes damaged. um, it tears, it actually tears, and it forms a scar. This scar actually catches, it's like a net. It catches debris like the fat, the cholesterol that that goes through, that comes with with your blood when it goes through your blood vessels. And this is called atherosclerosis. um, it becomes a plaque basically. So your blood vessel becomes smaller and smaller. So if it doesn't change, it can actually become totally blocked, and no blood can go through. So if it supplies your heart, you can have a heart attack. And if it supplies your kidneys, it can actually lead to kidney failure, and you can end up getting dialysis because of the kidney failure and in need of a kidney transplant. As I said, it takes years before these things happen. For males, if your high blood pressure or hypertension is not controlled, it can also cause erectile dysfunction, because for penis to stay erect, or for a male, for the male population to have an erection, they do need a good blood supply. And if your blood vessel is not giving your penis, for the boys, the good blood supply, it's not gonna do the trick. You're gonna have an erectile dysfunction. For vision loss, um, if your hypertension is not treated, or you are not controlling your high blood pressure, it can lead to like burst blood vessels. So when you have your eyes checked, the ophthalmologist or the eye doctor can actually see it. Um, we have very, very delicate blood vessels in our eyes. And if it's not controlled, the high blood pressure is not controlled, it can actually burst. And it can lead to vision loss or blindness. Um, for the peripheral artery disease, it's the same thing. If your legs, your arms, stomach, and things like that is not getting enough blood, because your blood vessel has weakened, it got a lot of plaques in them, and it gets hard instead, or it becomes firm instead of as I said, our blood vessels normally elastic or flexible. This can lead to the narrowing of your blood vessel, and you can have problems in your legs as well. So that when you get a wound, it will have a hard you will have a hard time treating your wound, because it doesn't have a good blood supply. So basically, what I'm saying is, please, please control your high blood pressure. Or if you know someone who has been diagnosed with high blood pressure, control your blood pressure. First, uh, think about your lifestyle. Think about if you are doing everything in your power to become a healthy person. And if it doesn't um, treat or cure your high blood pressure, you really need to take some medication to control your blood pressure or your high blood pressure. That's it for today. I hope you learned something. Thank you so much for watching. Take care and be safe. Bye.